few. And joining us to break down just what is Peter Pitts, the president of the Center for Medicine in the Public Interest. So what variants are U.S. health officials the most worried about here?
Well, we're very concerned about the South African variant, the variant out of Great Britain, and of course out of Brazil. Even though our numbers are looking good, both infection rates and deaths are down, and we are rapidly getting our population vaccinated. We're still a little bit behind Israel, but we're certainly catching up. We're very concerned that once the vaccination programs really hit full speed, people will get lax, take off their masks, stop social distancing, and practicing enhanced personal hygiene. These new variants are very contagious. So, even the least bit of let up is going to allow the virus to regain its velocity, and we cannot allow that to happen.
Which is the most contagious of these strains, and how dangerous are they? I mean, we know that obviously some of them don't react to the vaccines, and we'll get to that, but what's the threat here, the symptoms that you see?
Well, in the U.S., we're seeing a preponderance of the British variant, although South Africa and Brazil are unfortunately on the uptick, and there may be one coming out of New York where I'm sitting as well. It's important to understand, though, that these variants are more contagious. They're not necessarily any more deadly or dangerous, but we want to make sure that infection rates stay low, and that means vigilance against these variants. And the good news is that the 3 vaccines approved in the U.S., the Pfizer-BioNTech vaccine, the Moderna vaccine, and just last week, the Johnson & Johnson single-dose vaccine, are very effective at making sure that whatever variant someone might get infected with, if they get sick at all, those systems will be significantly mitigated.
Interesting. Even against the South African variant, because that's where there have been concerns.
Yes, I mean, the data looks very good. Obviously, there's a lot of science yet to be done, but I think the message is the urgency of getting vaccinated is crucial because it does work against these variants. And certainly it works in making sure that no one that does get infected suffers serious manifestations or death.
Now, how is the vaccination rollout going in the United States? You mentioned that it's moving quickly. You're almost catching up to Israel, right?
Yeah, we're making pretty good progress. We've figured out the logistics problem. We were so good on the science, we relaxed on the logistics. But with a new president who sees himself as the convener in chief, Washington has been meeting with state capitals, and states have been meeting with their counties to make sure that we can coordinate both supply and demand, both through mass vaccination centers at convention centers and sports arenas, as well as doctors' offices, pharmacies, and hospitals. Right. So we're making sure that the product gets to where the people are. And the good news is that Americans now are clamoring to get vaccinated. We have really been able to tamp down vaccine skepticism, which was a big problem initially.
Now, obviously there's a question of whether or not the U.S. should be rolling back restrictions in different states, given the presence of these variants, but also given the effectiveness of the actual vaccines themselves. If you get vaccinated, can you carry the coronavirus and pass it on? What do we know about those statistics?
Well, this is basic science. Obviously, if you get vaccinated against the coronavirus or against the annual flu, you can still get sick, and you can certainly spread the disease. So having a vaccination is not a carte blanche passport to take your mask off and go partying in bars and restaurants. You have to be very careful to maintain masking, certainly social distancing and personal hygiene. This is an education effort as well as a logistics effort relative to vaccinations. People have to understand that even when you're vaccinated, you can still infect others, and we can't allow that to happen, especially with these new highly infectious variants.
Right. All right. Well, that's something important that people do need to understand and are still, I think, unclear about. So thank you for clearing that up. Thank you so much for joining us, Doctor. We are out for a